My name is Ashley Cowart. I am part of the Denver Cohort at AHU University, and I am submitting my heart and abdominal assessment for health assessment. Knock, enter the room, perform hand hygiene, provide privacy. Hi, my name is Ashley. I'm going to be performing an abdominal and heart assessment on you. Is that okay? Can you tell me your name and date of birth?
1996.
Okay. Can I check your wristband just to confirm that?
Mm-hmm.
Okay, great. Has anyone ever told you that you have high blood pressure?
No.
Okay. I'm going to just move this off just a little bit. Is that okay?
Mm-hmm.
So I can look at your chest. Can you just sit up a little bit straight? Okay, looking at his abdominal and chest region, I don't see any masses, bruises, lesions. He has fine hair present. Looking especially at the fourth and fifth intercostal space, I don't see any pulsations where the apical pulse would be. Looking everywhere else, I don't see any impulses, so everything looks great. So now I'm going to go ahead and touch you. Is that okay?
Mm-hmm.
All right. Okay, again, I don't feel any masses, lesions, bumps. I'm going to go ahead and feel for his apical pulse, which is at the fifth intercostal space, mid-clavicular line. So I'm going to go ahead in here. Mid-clavicular line. Okay, and I can feel the apical pulse. Now I'm going to go ahead and I'm going to auscultate. I'm going to listen to the apical pulse for 30 seconds and multiply it by 2 so I can get the heart rate. So again, I'm going to go to the fifth intercostal space, mid-clavicular line. Can you just sit up a little straight? Okay. I can hear the apical pulse. I hear a lub dub, so S1 and S2, and I'm going to time it for 30 seconds. Okay, and I got 34, which times 2, that is 68. So 68 beats per minute for his heart rate. I didn't hear any murmurs, gallops, anything like that, but I'm also going to go ahead and auscultate his valves, so aortic, pulmonic, tricuspid, and mitral. So we're going to go ahead and go there. We're going to do both bell and diaphragm. We're going to start with the diaphragm, though. So I'm going to go ahead and come to the second intercostal space. Okay, second intercostal space, and I'm going to listen at the aortic valve. Okay, and I hear a lub dub, S1, S2, and I'm going to come over to the left second intercostal space to listen to the pulmonic valve. All right, that is also a lub dub, S1, S2. And now I'm going to come ahead and go down to the fourth intercostal space to listen to the tricuspid valve. Should be around right. Yep, I can hear the tricuspid, and that is also a lub dub, S1, S2, no murmurs, no gallops. And then I'm going to go ahead and go to the last one, which is mitral at the fifth intercostal space. Okay, yeah, that also sounds great. That's another lub dub, S1, S2, no murmurs, no gallops. But I'm going to go ahead and listen to them again with the bell to double check for any murmurs or gallops. So again, going to the second intercostal space to the aortic valve. Okay, everything sounds great. No murmurs, no gallops. I'm going to go to the second intercostal space again. The left one, though, to listen to the pulmonic. Sorry, I had to adjust this. Okay, sounds great. And then we're going to go to the fourth one to go to the tricuspid. And then we're going to go to the fifth one to listen to the mitral valve. Okay, that's cool. So there were no murmurs, no gallops. I heard S1, S2, so the leb deb. Everything sounds smoothly. I didn't hear an S3 or S4, so auscultating, everything went great. The patient had great S1, S2, and just heart sounds overall. So now we're going to go ahead and go on to your abdominal assessment. So do you have any issues with urination?
No.
No? Okay. Can you just go ahead and kind of lie down just this way? Yes. Okay. Perfect. Okay. Huh? Okay. So now we're going to go ahead and I'm going to be inspecting the abdomen. The umbilicus is inverted. There is a nice contour of the stomach. The abdominal region is flat. There are fine hairs present, but there is no indication of any masses or lumps. I don't see any bruising. There's no lesions. Everything is symmetrical. The abdominal region looks symmetrical. Skin condition, the skin color is appropriate for the rest of it, for his, for his ethnicity, and it's appropriate and consistent with the rest of his body. Skin temperature is warm. So now I'm going to go ahead and I'm going to auscultate for your bowel sounds. So I'm going to start in your right lower quadrant, and I'm going to be using the diaphragm. And I'm just going to put it right here. Oh, sorry, it was cold. I would warm it up before. Okay, and now I heard a bowel sound, so now I'm going to come up to the right upper quadrant. Okay, hear bowel sounds going to the left upper quadrant. And hear a vowel sound, so I'm going to go to the left lower quadrant. And I can hear vowel sounds, so everything looks great there. Now I'm going to go ahead and percuss. So what I'm going to do is I'm going to take my fingers, I'm going to tap. So just so you're ready for it this time. Okay, so I'm going to start in the right lower quadrant, and I'm just going to take my two fingers and I'm going to tap. Let me know if you feel any tenderness, okay? Okay, abdominal sounds were tympanic. And now I'm going to go ahead and lightly press down. So I'm only going to go 1 to 2 centimeters. So let me know if you feel any tenderness or anything like that, okay? So we're going to start in, again, the right lower quadrant. Tenderness. We're going to go up to the right upper quadrant, excuse me. Tenderness. Okay, the left upper quadrant. Tenderness. Yep. And then left lower quadrant. Still no tenderness? Yep. Okay, and now we're going to move on to deep palpation, which I'm going to go 4 to 6 centimeters deep. So we're going to kind of go a little bit deeper this time. Again, tell me if you feel any tenderness. Going to the right upper quadrant, left upper quadrant, left lower quadrant. No tenderness still? No. Okay, great. So no tenderness was noted. I didn't feel any masses or lesions, or not, excuse me, not lesions. I didn't feel any masses or bumps or anything of that sort. So palpation looks awesome. I would go ahead and wash my hands, and then I would document my findings.